New fears of a global health crisis after an outbreak in India of an untreatable strain of tuberculosis. Doctors say the disease has already infected at least a dozen people, but could very easily spread into a worldwide pandemic. Here to help us assess the threat is Dr. Sreedhar Potarazu, CEO of Vital Springs Technologies, and Dr. Mark Siegel, part of the Fox News Medical Aid team and an associate professor of medicine at NYU's Langone Medical Center. Gentlemen, welcome to you both.
Hi, Shannon.
Thank you.
All right, Dr. P, I want to start with you. What exactly does this mean, untreatable?
It means that there's a resistant strain of TB that they've detected that is not amenable to conventional treatment of tuberculosis. The WHO issued this warning to India at least a couple of years ago in terms of the fear that this was going to continue to spread. And now when you see the number of cases that have now been just reported, you can only imagine how many other cases that are not being reported. And this is a real concern, especially in a country like India, where you have, a tremendous population that is densely concentrated, where the diagnostic techniques for detecting this kind of strain are very poor, and just the overall hygienic and treatment standards are also well below what really is necessary.
Dr. Siegel, is there a strategy for dealing with this? I mean, do you have to quarantine these folks? Is there any way to ramp up research to try to find something that might work? What do you do next?
Shannon, just to give you an idea what we're talking about here, there's 9 million cases of tuberculosis in the world. 2.3 million of them are in India. So you see 100,000 cases of drug resistance in India. By comparison, here in the United States, we only have 10,000 new cases a year. So India is really of great concern. You have to, as you said, isolate people who are sick, go for early diagnosis, go for more public health awareness, early treatment with antibiotics, but you don't want to treat with the wrong antibiotics. And let me talk for a minute about what tuberculosis is. We used to call it consumption. You know why? Because it consumes you. You end up with a lot of weight loss, with fevers, with night sweats. You get tremendous weakness. This is a hook-shaped bacteria, which under the microscope looks red. It's very, very dramatic looking, but it's very hard to identify in a live person. And it's not that easy to spread it either, by the way. You're not going to get it by touching somebody. It's literally deep coughing on someone or very close contact that will give it to you. It used to kill 2/3 of the people who got it. But because of modern medicine, because of antibiotics, because we know what it is, we actually have done a tremendous job at eradicating it. India and all third world countries are behind the curve on this.
And Dr. P, you talked about that close physical proximity that the folks in India often have, that the population is very in close quarters oftentimes. How concerned are you about it spreading beyond the borders of India? What is the threat to the rest of the world?
I'm very concerned. Ironically enough, this is a time when thousands of Indians now go back to India from the United States for summer vacation. They travel to a lot of the cities where these cases have been reported. I go frequently to India myself, and I can tell you that the concerns with pollution, the air quality, the lack of adequate drainage, and, I'm sometimes ashamed to talk about this, even about, a country from where my parents have come from. But the infrastructure to support hygiene is very poor. Even in hospitals, where we've seen cases of inadequate hygiene amongst healthcare professionals and otherwise, that one that's traveling to India now, over the summer holidays or even vacation, needs, as Dr. Siegel said, needs to take some serious precautions to make sure that they aren't inhaling, this bacteria, and to the extent that they get any symptoms, the likes of what's characteristic, that they get examined and made sure that they don't have anything of this kind.
Shannon, just to emphasize Dr. P's point here, of the 10,000 cases in the United States every year, 60% of them come from outside of our country, from people that travel outside and then bring it in, or from immigrants that come in with it.
Are there any groups, Dr. Siegel, quick last question to you, that are more susceptible to this type of infection? I mean, the elderly, the young, anybody who needs to be extra special careful if they're traveling?
There's no question about that. People that are immunocompromised, people that are run down, people with chronic illness, the very young and the very old, especially elderly, don't have the same kind of defenses. And we see them in certain states here, by the way, like New York and Florida and California have a very, very high incidence compared to the rest of the country.
All right, doctors, thank you to you both. We'll keep an eye on it.
Thank you.